10 years ago, we created this continuing dental education facility for the sole purpose of providing clinical training to private practitioners.
What this program does for the dentists that helps them for the rest of their career is to help them develop the fundamentals that they need in dentistry, both from a restorative dentistry standpoint and from an aesthetic dentistry standpoint. We start with literature review. Literature review allows us to take a historical perspective all the way up to current day on really a scientific approach to what we do in dentistry. And we couple that with preclinical courses, workshops for the first 6 to 7 sessions for the participants, for them to really understand how we like to do things in a very systematic approach. Then we move into the clinic with patients, and then we go into our lecture schedule for the rest of the year at 32 sessions. Combining all 4 of these pieces really lays out a day that I do believe is very unique, coupled with the quality of the faculty that we have.
We use a tell, show, do method here. Faculty to participant ratio is about 1-to-1, and as a result, we can sit next to the participant when they're preparing their first case. So they're told what to do, they're shown what to do, and then they actually do it.
We have 15 state-of-the-art operatories. We have a 52-seat theater. We have an operatory under glass. And those things in combination increases your quality education experience.
I've taken tons of courses in the past, and you can read about things in a textbook and see it done. You can even watch somebody else do it, but until you actually get your hands in there and do it a few times on your own patient with the understanding of the background and really get the hands-on, it's not gonna click. And what's great about this program is you get the chance to treat more than one patient personally, which is unbelievable.
You look at the whole picture. You become a better detective when you treatment plan. You see things and you can predict things better.
Once you have obtained the protocols and skills that this type of course gives you, you could definitely increase your revenue, your bottom line in your practice.
Having taken the NYU aesthetics course, I was able to deliver treatment plans at a much greater scale than I previously was before. I was able to develop treatment plans and execute them, and as a result, complete much larger cases.
Lots of my colleagues in Philadelphia asking me, why you commute that far, 3 hours, if we have 2 dental schools in Philadelphia? But I'm saying, but they don't have this kind of program. And just to be in an undergraduate program or any other program and not being happy, this is a unique program at NYU. And I don't think there is any other program in the country that devoted to aesthetics and full function.
You know, I think this program differs from other programs in the country because of our approach. And our approach is really one of an interdisciplinary approach, where we're taking the different disciplines of dentistry, prosthodontics, periodontics, and orthodontics, and these difficult type cases, simple to complex. This integration of the disciplines allows us to diagnose these cases in a way so that we have a kind of a stepwise approach to diagnosis to create results that are long-lasting and are consistent.
We're talking about cutting-edge stuff that literally this is the only place I can imagine learning it, and anywhere else that you're going to learn it from is piggybacking off the research coming out of NYU anyway. So I'm really at the core of it, and that's why I recommend it with no hesitations.
This is the greatest college and the greatest university in the greatest city on the planet. And you know what this program here is? It's the greatest aesthetics program in the greatest dental school in the greatest city in the world. That's what it is. It's just that simple.